peptides are exploding in popularity.
Why was I so late to the game on peptides? Like, everybody's doing them?
This is my first morning trying peptides.
From celebrities and influencers to suburban moms and even teens, millions are sharing their peptide stacks and jumping on the latest health craze.
These two peptides have changed my life. Let's talk about it.
So what exactly are peptides? Well, they're short chains of amino acids that act as biological messengers, sending instructions to cells and tissues involved in metabolism, tissue repair, hormone regulation, and immune response. Peptides can also be synthesized in a lab and injected by people who claim they help with building muscle, healing injuries, anti-aging, even delivering a sun-kissed tan without UV exposure. Health and Human Services Secretary Robert F. Kennedy Jr. has been vocal about the benefits.
I've used them myself and used them with really good effect.
Now, under Kennedy's leadership, the FDA will decide whether to ease restrictions on some peptide injections. But Dr. Michelle Arthurs, a lifestyle medicine physician at Kaiser Permanente, worries the hype is outpacing the science.
The claims really are almost like superhero-like, right? They're marketed in a way that leads us into a seductive pathway of this is going to work for me no matter what, and I will have these results. And it's a powerful message, and it's really hard from a physician's standpoint to undo that.
Not all peptides are created equally. Some, including GLP-1 medications like Ozempic and Wegovy, as well as insulin, are FDA approved after years of rigorous clinical testing. But the vast majority promoted online are not FDA approved. Most are sold strictly for research purposes, with little oversight.
It's kind of a wild, wild west. We don't know that they really can do what they say they can do. We don't know truly what's on that ingredient list. And without that rigorous testing, we run the risk of unknown consequences, possible interactions with current medications that we might be taking. And we also just don't know long-term what this can mean, whether or not it's going to harm us 10 years down the road or not.
The Biden administration tightened restrictions on more than a dozen peptides over safety concerns. Secretary Kennedy argues those restrictions have pushed consumers toward an unregulated gray market in search of treatments they can't get anywhere else to look and feel their best. And that's exactly what worries Rena Dukor.
First, I look at it as like, how can you inject something without understanding what's in this vial?
Dukor is the founder of BioTools, a lab that has tested pharmaceutical products for drug companies and federal agencies for years. Now, through a startup called Finric, consumers can actually send in their peptide vials to find out what's actually inside. She says nearly 30% of the peptide samples they've analyzed were either mislabeled, under or overdosed, or contaminated with toxins and even bacteria.
Among the thousands of tests that we have been doing, we do find either live or dead bacteria in a lot of these vials. That could lead to hospitalizations.
Earlier this month, career scientists at the FDA outlined potential safety concerns and a lack of consistent data regarding peptides, too. And doctors we spoke to say easing restrictions without the proper testing could be problematic.
With any new product, peptide, whatever it might be, that's introduced, we won't have long-term data on that. People should at least know that they're exposing themselves to a lot of unknown risks, most likely unintended consequences. And years later, we will look back on some of these peptides and wish we had that forethought to say maybe not.
The FDA panel of outside advisors includes members with ties to the peptide industry. And they'll meet today and Friday to review 7 peptides for uses ranging from ulcerative colitis to insomnia and obesity to see if they should be added to a list of substances that can be safely produced by pharmacies. And then it's up to the FDA to decide. They typically go with the panel's recommendation.